Good morning everyone, I am Dr. Francesco Martinetti, specialized in orthodontics, and I am pleased to share with you this case of Class 3 malocclusion, which means a protruding jaw and chin treated with an intraoral appliance without having performed orthodontic surgery. The patient is an adolescent and came to our attention. His name is Matteo, the age of 13, with this smile, with all his teeth crowded, especially the upper ones, and he wanted to correct his smile, to treat these malocclusions at this age with braces. Instead, later on, you can see how much the mandible continues to grow. If it grows too much in adulthood, then this type of malocclusion can be corrected with surgery. We treated this boy as an adolescent without waiting for adult surgery. And why is that? Because we were able to compensate for this malocclusion using only orthodontic braces. And you can see inside the mouth how the teeth were crowded at the beginning, and there were still two baby teeth present on and two of the canine tooth above stuck up high because there was no space for it to come down. Again, from the side photo, yes, the lower teeth are much further forward and more crowded compared to the upper teeth. And you can really see the arrangement of the teeth in a Class 3 malocclusion where all the lower teeth are ahead of the upper ones. So the lines are red because they don't match up. In normal occlusions, they should line up. So the lower teeth are shifted much further forward and the upper teeth are shifted further back. Looking at the intraoral photos, we can see that the palate is narrow and has a triangular shape. We need to try to widen the palate to make room for all the teeth. The upper canines don't fit because the palate is too narrow. On the lower arch, instead, I again have a much larger arch, which is also crowded, with the incisors overlapping each other. From the panoramic X-ray, we can see that the upper canines are blocked and can't come out, and we also see the presence of the tooth buds, the wisdom teeth below. In order to move the lower teeth back, we need to create space behind them. So we have to retract them, and we need to remove the wisdom teeth, the tooth buds, early. You can see that the roots haven't formed yet. The upper ones, on the other hand, we can leave because the upper teeth will be moved further forward, so I don't need space in the back. You see, at the beginning, before the treatment, the teeth are removed. Meanwhile, from the X-ray saw, these are all the data collected beforehand to make a proper diagnosis. You see, what does it tell us? That it's a Class 3, not only dentally, but also skeletally, so the mandible is further forward and there is also an increased lower facial height. So the height has increased, the mandible is growing forward and downward. We started with a palatal expander. What does this device do? By activating it, there is a little screw that actually widens the palate. Here we have a suture that calcifies at around 10 years old, but in children we still have the possibility to stimulate it to grow even in the following years. And you can see that by widening the appliance, the palate, a small gap opens up here in the front, which then creates the space for the canines to come out. And then afterwards, these bars are placed underneath and elastics are added. The mechanism is to move the lower teeth backward and to slide the upper teeth a bit forward to correct the bite and the malocclusion. This appliance was worn for about 6 months. After the 6 months, you can see that the patient achieves a correct occlusion in the back teeth. This is called moving from a Class 3 to a Class I molar and a Class I canine relationship. In this case, the patient did not want to treat the malocclusion with clear aligners, but instead chose plates, wire, and Brachezza traditional fixed appliance. We use both techniques in our practice, and after 18 months, you can see how the teeth are aligning. Here, you can see that elastics have been placed. I'll show you what is used. These elastics are worn at night, and at first also a bit in the afternoon. They are put on and taken off, and they help the teeth to close and fit together properly. You see, the teeth really need to fit together, and these elastics help them to close well against each other. After about 2 years of treatment, you can see this is Matteo's final smile. As you can see, look at how his smile has changed. Now he can go through his teenage years confidently, smiling, and in terms of the side profile, you can see we've straightened the teeth. Even though the lateral profile has remained the same, the jaw, the bone is still a bit more forward, a bit lower. So with orthodontic appliances, After a certain age, we can no longer act on the skeletal level. We can only work on the teeth and the bone surrounding the teeth. So we intervene in this area here, we don't change the position of the chin. And this is the before and after. You can see how we have properly corrected the alignment of the teeth. From crowding with a narrow palate, we widened the palate, created space for the upper incisors and canines to come down and properly align the lower teeth, achieving good coordination between the arches. You can see that at first the teeth on the sides didn't fit together well. Now look at how well the upper and lower teeth mesh. Have we moved the lower teeth back and the upper teeth slightly forward. On the other side as well, you can see how well the teeth fit together. So here too we've corrected not only the aesthetics but also the bite. And the palate has actually changed shape. We widened the palate and transformed it from a triangular shape to a U-shaped horseshoe form, where all the teeth now have space to fit in the arch. On the lower jaw, we aligned and moved the lower teeth back to allow for proper occlusion, first removing the wisdom teeth at the back because we moved all the lower teeth backward. This is the final panoramic X-ray. You can clearly see how all the teeth, the roots are, all well aligned. You can see how straight they all are, and we will decide when Matteo is older whether to remove the upper wisdom teeth. We will make that decision later on. And this is the final X-ray that we took. You can see that the teeth fit together well, while the skeletal bone bases, that is, the mandible and the chin below have, remained in the same position. And these are the tracings we made, the cephalometric ones, both initial and final, which are superimposed on each other. You can see how the blue ones, which are the final ones, show how the teeth have shifted from red to blue in different ways. However, the bone bases have remained more or less the same. So we are not acting on the bone bases, but on the teeth. And we do have certain limitations. If the malocclusion had been even more severe, we wouldn't have been able to correct it. But by making an accurate initial diagnosis, we managed to correct this dentoalveolar discrepancy, as it's called. If you have any questions, feel free to ask us. I wish you a good day.